Hi, everyone. Welcome to the pre-publish webinar for the 2023 class Patient Engagement Ecosystem Report. I'm Adam Cherrington. I oversee our digital health team at class and happy to be joined by my partner in crime here, Dan Czech. Hi, Dan.
Hi. Hi, everyone. I'm Dan Czech. I am the Vice President of Insights at class and Adam's partner in crime for all things patient engagement.
So Dan, we are just about to publish this report, and our goal today is to share with vendor partners some of the early findings and things we learned from this report. Why don't we take a step back, first of all, and just share, hey, what is an ecosystem to class? Why did we even do this report?
Yeah, I think, Adam, if you look back a couple of years ago, this is now our third iteration of the patient engagement ecosystem report. And the problem we were faced with at the time was the landscape for patient engagement is one of the broadest and perhaps messiest areas that we try to measure at class. There are so many solutions, and every day it feels like a handful of new solutions pop up and hit our radar. And there are also a ton of different capabilities and a lot of different ways to approach patient engagement. So really, this ecosystem came out of necessity to help organizations understand the different options out there. And sometimes it's not easy to compare in an apples to apples way the different solutions in the market. Some want broad platform vendors, some want solutions that meet a very specific need. So this was really an attempt to let vendors tell the market what they do and don't do. And then from there, let a provider organization use that data to make informed decisions, or at least to narrow down their search for vendors based on the type of work that they do and the capabilities that they offer. So at a high level, that is why we do ecosystem reports, and specifically this patient engagement ecosystem. Adam, anything you would add to that?
Yeah, just that in the report itself and over the past few years, we have a model of how we like to think of this. And this really guided our questions for the report. So on screen now, you'll see this platform model that we've used for some time. This came out of our previous patient engagement summit. And we just asked organizations, both provider and vendor leaders, some patient advocates, what should a core strategy entail? So the readers in the report will see this model again, won't they? And just some of the key pieces that ought to be part of a generalized strategy. And we won't go through all of these on this webinar, but the vendors ought to recognize this because they filled out the questionnaire that had a lot of these things. So we know that this model, it's time to update it a little bit. We're going to see some of that in our upcoming summit that we'll host in November. And that will be one of the objectives. How do we improve upon this and make it a little more modernized, a little more relevant to the patient's perspective? But Dan, I want to share this as well as some of the other ways that we asked organizations to clarify what they offer. This is a list of other patient-centric capabilities. Again, we won't go through and explain all of these today, but this ought to look familiar for our vendor partners. A lot of things that we could measure deeply, and we do validate in our research. Each of these could become its own category at some point, but to your point earlier, sometimes a provider just needs one of these things, right? They're just looking for one thing.
So I think it's one of the things, Adam, as you maybe show the next slide of the provider-centric capabilities as well that we measured in here. One key piece of insights that's in this report is a high-level perspective for provider organizations on each of these three categories: platform capabilities, patient-centric capabilities, and provider-centric capabilities. What % of those are offered by a vendor? So an organization will get a quick snapshot of the 12 platform capabilities. How many of the 12 are offered today and in use today by each of the different vendors? So we try to help them see this from a high level. Who are the solutions that maybe you could go broadly with? And then there will be additional resources on the website that will help them go individually into any of those areas.
So we've talked a little bit about the model and some of the approach we took for this report, but do you want to just walk our participants through what did that look like? How did we get the information that's now in the report?
Yeah, so the many of those areas, in fact, all of those areas that Adam was just sharing on the screen, we sent out a survey to every vendor. We had 108 vendors that are highlighted in this report, and they were asked to share with the market what they offer or don't offer today. What do they offer, and what percentage of their customers have adopted each of those capabilities? If they don't offer it today, is it something they have a partner or a preferred partner for? And then is it something that's on their roadmap, or is it a capability that they don't intend to offer? Sometimes it's just as important to understand what a vendor may not have on their roadmap as it is to understand what's available today or what could be available in the near term as you're considering vendor partners for the future. So in all of those cases with 108 vendors, we invited them to participate and to share with class from their perspective what they have available today and what the adoption has been like of those capabilities. And then we put our analyst hats on and sorted through the data to try to find some of the interesting findings, not only by vendor, but as a market. What has changed year over year, and what are some of the key trends that we're seeing in the data?
So let's get to that part, Dan. I'm excited to share the following with our audience. They're the first to see this data. This is in the report. It's not even published yet. Why don't you orient the audience to what we're looking at here?
Yeah. So Adam showed that circle model, the 12 platform capabilities. This is now the third iteration of this report. You can see across the bottom the 3 touch points, 2019, 2021, and then this current report. And we've watched over time the percent of vendors that claim a certain capability. And all this is a trend of the percent of vendors claiming different capabilities. And you can see there are a few that we highlighted for the growth specifically from 2021 to 2023. Areas that we've validated in other research that are high on the priority list for patients. Patients really want to be empowered in their care, so they want to be able to register and check in for their appointments. They want to be able to pay their bill in a frictionless way. They want to be able to request refills of their prescriptions. Another area that didn't have quite the same year-over-year growth, but it did from 2019 to 2021, is self-scheduling and rescheduling. So all of these elements where patients really want to take control of their care, they want to be involved, and smart provider organizations are also looking at these as ways that they can offload some of the burden from their staff and potentially almost look at the patient as an additional employee. I did want to call out, Adam, I think it's really interesting as we look at not only where vendors investing more year over year, but we've also now triangulated this with where provider organizations purchasing technology, what's top of mind for them, as well as what patients care most about. They really align quite well in a few different areas.
Yeah.
And this has informed our research roadmap. Several of these areas we've either published research on in the past 12 to 18 months, or it's on our research roadmap for the next 12 to 18 months. Self-scheduling is a great example. We are in the middle of research collection for our first study in that segment.
Yeah, absolutely. We're giving the market an update on the intake world. That one's coming up. We just did a communications report. Yeah, to your point, we do want to align with what providers need and where vendors are focused. So lots of opportunities to kind of see where the market's going.
Right.
Anything else that jumped out to you on this, Dan?
No, there are a couple areas where we saw a little bit of a drop year over year. Some of that is due to just the number and types of vendors that have participated. I get more excited about some of the gains year over year than I do concerned about some of the drops. You'll see variability in the data. One area that kind of surprised me of the high growth year over year that I can't quite get my finger around why that is prescription refill requests. We know it's high on the patient's desirability.
Right.
I was a little surprised that the vendor development has followed suit.
Let's go to a couple other areas more specific to patient-centric capabilities, areas of growth there, and also provider-centric areas. So here we have just evidence of growth on both price transparency and virtual tours. Again, this top portion is other areas that are important to patients that guide them directly in their care. I think as patients, we're happy to see some traction on price transparency. I think we all hope it'll go much deeper than it is today still. But that feels like a good sign that we're trying to be more consumer focused and really make it more of a true transaction that we expect outside of healthcare.
Yeah. And this is really exciting when you compare it to some of the the patient data that we've collected. When we had asked patients outside of the care that they receive, what are the most important factors that you consider in choosing where you receive care? One of the areas that surprised me that actually stood out is the price transparency tools, especially among younger patients in that 18 to 25 demographic. These are patients who are just exiting high school and college. They're getting into the job force for the first time. They may or may not be on a high deductible plan or not have insurance at all. So they care quite a bit about knowing what they're about to pay for their healthcare. So I think it's really encouraging that vendor development is starting to follow what patients are really caring about.
It's a great observation. Let's jump to the bottom graph for just a moment before we wrap up. So not surprising to see that reputation management, marketing campaigns are top of mind, or at least areas of growth, right? Because of how competitive things are. There's a lot of market share people are seeking. You've got revenue challenges, right? So people are trying to make that up. Organizations are. So to see that growth kind of aligns with what the market is telling us.
Yeah. And I think that's another indication there of that growth, Adam, is when we first did this study in 2019, this one was actually much lower. And I think some of the vendors that are focused in this space, vendors like Social Climb or Raider 8 that are now more prominent among some of the provider organizations we're talking to, they were not crossing our radar 4 years ago when we first started doing this research. This wasn't something talked about by provider organizations as much as it is today. So again, really encouraging to see the development follow the needs of the provider organizations. That's an encouraging sign for us.
Yeah. I think of the CRM tools we're measuring. We have rich data on Salesforce and Epic and how there's marketing campaigns and tools used there as well. And so you do see that.
Right.
Well, Dan, this is a fun report for us. And, we get a lot of providers that say, boy, I really appreciate the chance to just understand what's out there. Years ago, we had a provider say, I just need you to help me sort through all the information that's available. And this report specifically is intended to help with that. And so we hope our provider friends will benefit. And I'm confident that vendor partners will also be able to see how their capabilities compare with some of the trends and competitors and so forth. So any final thoughts before we wrap up?
No, I think we've covered a lot of ground in this brief webinar. Any suggestions from you, Adam, on if somebody wants access to this, we'll give it to a provider organization as a thank you for their participation with class. But what about others who want access to this?
Yeah, so anyone interested can contact their research director at class directly or send me a note. A lot of our partners getting this webinar will already have access to it in the form of their membership, but it is available if others are interested. We will have this report go out very, very soon for vendor review, and we're excited for people to just take a look at it and hopefully benefit and hopefully improve healthcare. That's the big picture. So we want to thank all of those that already participated in the survey. That was not an easy request, so we're grateful for their time, and we look forward to sharing this with providers and helping them orient themselves through the world that is patient engagement and digital health. So, Dan, appreciate all your hard work on this. You've done a great job, and the team's really worked hard. So, our thanks to them. And again, any vendor partners that have questions, feel free to reach out. So, thanks again, Dan.
Thank you.